Hello everyone, myself Dr. Monalisa. I am here for discussion of the NEET PG Anatomy MCQ part 13. So this is the Telegram group link of Unacademy NEET PG platform. If you want to join the Unacademy platform, please do join this group. It's a very useful group. And if you want to join the Unacademy NEET PG platform, you can use my referral code, that is Dr. Lisa-YT. And with this you will get 10% discount on the Unacademy subscription. Now before starting today's session, I want you to tell about my own Telegram group, that is the link is provided below, and you can join this Telegram group link for the discussion of anatomy MCQs and the doubts related to anatomy subject. So starting with today's discussion, so today I am discussing the first MCQ. So facial nerve innervates all except, so see the options: procerus, corrugator superciliary, masseter, depressor, angulae oris. So 4 options are given and you have to mark your answer. So before that, I would like to describe the facial nerve, how it is supplying the different muscles of facial expression. So I will discuss firstly the important points and then again come to the MCQ. So see here, this is the diagram in which you can see the yellow color structure which you are seeing is the facial nerve, and just this is the facial nerve as coming out from the stylomastoid foramen, as you can see here, and it is traversing. So this structure is facial nerve. This is facial nerve. Okay. Now this facial nerve enters into the substance of parotid gland. So I am just outlining this. This is parotid gland and it enters inside the substance of parotid gland and on the anterior border of parotid gland. So what is this? I am highlighting, this is the anterior border of parotid gland, and from the anterior border of parotid gland you can see some branches, the terminal branches of facial nerve is emerging. So let me just mark the name of these branches. So this is temporal, this is temporal nerve, this is the zygomatic nerve, and these branches which is coming out from the substance of parotid gland here, these are buccal. Actually buccal branch of facial nerve is divided into upper and lower buccal in relation to parotid duct. Lower down also we can see the branches here. So this is marginal mandibular. This is marginal mandibular nerve. I am using it with different colors so that you can visualize. This is marginal mandibular. So I think now it is visible. And the another branch which is just going down here, this is the cervical branch. So you can see here all the 5. So how many? Total 1, 2, 3, 4 and 5. There are 5 terminal branches of facial nerve which is emerging out from the anterior border of parotid gland, and these branches will innervate the facial muscle of expression. As you can see in the diagram, they are going towards the facial muscle of expression. They are going towards the frontalis muscle, orbicularis oculi, and many muscles surrounding the nose, procerus, nasalis, and also the muscles around the oral cavity, that is orbicularis oris. So many muscles are there. I will tell you about all the muscles supplied by the branches of facial nerve. Now this is just a schematic diagram in which you can see the branches of facial nerve. So as you can see here, this is the temporal branch supplying, giving innervation to frontalis muscle. Also you can see zygomatic branch going towards the nasalis muscle. Okay, buccal branch is there, cervical branch is there, marginal mandibular is there. So these branches are going towards the facial muscle, as you can see in the diagram. Cervical branch is going lower down to the platysma, and the marginal mandibular branch is going towards the depressor anguli oris. So don't worry about innervation of individual muscles. I will give you the list of all the branches of facial nerve innervating the respective muscles of facial expression. So now, as we have already seen, there are how many branches? There are 5 terminal branches. So I just want to give you the list of all the 5 terminal branches of facial nerve and which muscle of facial expression they are innervating. So starting with the list, as we already know, the first terminal branch is temporal nerve. So temporal nerve or temporal branch, you can say, that is a branch, terminal branch from the facial nerve. It is innervating following muscle. It is innervating upper part of orbicularis oculi, upper part of orbicularis oculi, frontalis, that we have seen in the diagram also, it is innervating frontalis muscle, and it is innervating corrugator supercilii muscle. Okay, so these are the muscles which is innervated by the first branch, that is the first terminal branch of facial nerve. Now moving to the second terminal branch of facial nerve. The second terminal branch is zygomatic branch. The zygomatic branch of facial nerve innervates mainly lower part of orbicularis oculi, the muscle surrounding the eyeball. So we have done with the second. Now coming to the third terminal branch, that is buccal. So as I told you, the buccal branch will arrange around the parotid duct and will divide into 2, upper buccal and the lower buccal. So third, upper buccal branch. Upper buccal branch supplies following muscle. So upper buccal branch supplies zygomaticus major and also the minor, the 2 zygomaticus major and minor muscle, levator anguli oris, levator anguli oris, the third levator labile superioris muscle, and one more muscle which is related to the same name, that is levator labile superioris aleknesi. So write down levator labile superioris aleknesi. And also the muscles of nose. So this is the list of the muscles which is supplied by the upper buccal branches. So as I told you, there is also one lower buccal. So moving to the next list, that is lower buccal branch. Lower buccal branch of facial nerve supplies following muscles. Okay, lower buccal branch supplies following muscle, that is buccinator and orbicularis oris. Okay, now moving to marginal mandibular. This is the fourth terminal branch, that is marginal mandibular branch. So this branch supplies following muscle. So write on the list. The branch supplies risorius muscle, depressor anguli oris. So depressor anguli oris muscle, also depressor, labile, inferioris, and also gives a slip to mentalis muscle. And the last branch, as I told you, the cervical is going towards lower down, it is going towards the platysma. So it is supplying the platysma. So lie down. The cervical branch will give innervation to platysma muscle. So done with all the facial muscles. Now, one of the muscle which was given in the option was masseter muscle. So I just want to show you this muscle. See here. So as you can see in the diagram, the masseter muscle is highlighted by a green arrow, and you can see, and actually the masseter muscle is muscle of mastication. It is a muscle of mastication. So it is not supplied by facial nerve, but it is supplied by mandibular branch of trigeminal nerve. So masseter muscle is supplied by mandibular branch of trigeminal nerve. So we have done with all the option as a. Now moving again to the MCQ. So let's move to the MCQ. Facial nerve innervates all except. So procerus is a muscle of facial expression. Corrugator superciliary, again the muscle of facial expression, and depressor anguli oris is also a muscle of facial expression. So the option which is correct is the masseter. Masseter, which is a muscle of mastication, it is supplied by mandibular nerve and not the facial nerve. So done. Now moving to the next MCQ for today's session. Okay, which nerve arises by two roots that surrounds the middle meningeal artery? Okay, so the hint which is provided in the MCQ is that the nerve which is arising is by two roots. Okay, so the nerve which is arising is by two roots and it is surrounding which artery? Middle meningeal artery. So the option provided is auriculotemporal, buccal, mental, and zygomaticotemporal. So coming to solve this MCQ. Firstly, the MCQ is actually giving the hint, and if you are knowing that a nerve which is arising from two roots and is surrounding the middle meningeal artery, that nerve is actually auriculotemporal nerve. So I am going to show you a diagram so that you can visualize this better. So see here, in this diagram, the important part which can be visualized is mandibular nerve. So can you see this mandibular nerve? Actually auriculotemporal nerve is a branch from the posterior, it is a branch from the posterior aspect of the mandibular nerve. Again the mandibular nerve has got branches from its trunk, it has got branches from anterior division, it has got branches from posterior division. So this auriculotemporal nerve is a branch from posterior division of mandibular nerve. And what you can visualize here, that the artery, let me use red color, the artery which can be visualized, this is the artery, and this artery is middle meningeal artery. This artery is middle meningeal artery, and let me use yellow color, and you can see the nerve is surrounding, auriculotemporal nerve is just surrounding as a loop. Okay, it is highlighted also, it is surrounding that loop of the artery. Let me just enlarge this diagram. So if we enlarge this diagram, you can nicely visualize that auriculotemporal nerve is forming a loop around which artery? Around middle meningeal artery as shown in the diagram. So this is clear. So we have just approached the right option of this MCQ. So the correct answer to this MCQ will be auriculotemporal nerve as we have visualized in the diagram. Now I just want to give you the details of auriculotemporal nerve, as the MCQ has been framed on the topic of auriculotemporal nerve. So just few important lines about auriculotemporal nerve. So write down auriculotemporal nerve. Okay, auriculotemporal nerve is a branch from posterior division of mandibular nerve. Okay, it's a branch from posterior division of mandibular nerve. Okay, the nerve arises, as we have seen in the diagram also, the nerve arises by two roots. The nerve arises by two roots and encircling middle meningeal artery, arising by two roots and encircling MMA. What is MMA? Middle meningeal artery. Middle meningeal artery. So MMA is middle meningeal artery. So the nerve which is arising by two roots and which is a branch of posterior division of auriculotemporal nerve is encircling middle meningeal artery, and this two roots will again encircle the middle meningeal artery and will form a single trunk. So this encircles it and forms a single trunk. This will join together and auriculotemporal nerve will form a single trunk. Okay. Now just in brief, I want to tell you about the distribution of auriculotemporal nerve. So write down the heading. Distribution of auriculotemporal nerve. Okay. Now starting with the first distribution. So its first distribution of branch is auricular branch. The auricular branch of auriculotemporal nerve, what it supplies? It supplies skin of tragus. It supplies upper part of pinna. And also give innervation to external acoustic meatus upper part. So external acoustic meatus. So it is giving innervation to upper part of pinna, external acoustic meatus, and also giving innervation to tympanic membrane. Okay. So it is supplying upper part of external acoustic meatus, also giving innervation to tympanic membrane. So this was the first branch. Now moving to the second branch, that is articular branch. So it gives articular branch to, second branch is articular branch. It gives articular branch to TM joint. What is TM joint? Temporomandibular joint. TM joint, that is temporomandibular joint. Okay. Now moving to the third branch, that is superficial temporal branch. Superficial temporal branch is given to the skin of temple, and it also gives one of secretomotor fibers to parotid gland. So it also gives secretomotor fibers to parotid gland. Okay, so done with this. So yes, we have already marked the correct answer of the MCQ and we have seen the details of distribution of auriculotemporal nerve. Now moving to the next MCQ. Okay. So the third MCQ is parasympathetic fibers from 9th cranial nerve, means glossopharyngeal nerve, synapses in which ganglia, before giving innervation to parotid gland. So more or less it's very easy. Parasympathetic fibers of 9th cranial nerve, synapses with which ganglion, before supplying parotid gland. So this is a MCQ which is framed on the topic of parasympathetic ganglia of head and neck. So you have to know, so which of this ganglion is related to parotid gland. Okay. So for this MCQ again, otic ganglion is the right answer, and I will show you a diagram for this. Now I will show you that diagram, don't worry. This is the diagram in which you can see otic ganglion here. Let me just show you. So see here, this ganglion which you are seeing here is the otic ganglion. Okay, otic ganglion. So this is the otic ganglion, and the nerve will pass through this ganglion. The branches of the parasympathetic branches will cross the otic ganglion, and postganglionic fibers will arise, and through auriculotemporal nerve will supply parotid gland. No doubt about this. Now moving to the other option which was provided in the MCQ, ciliary ganglion, which is related for supplying the sphincter pupillae and ciliaris muscles. Submandibular ganglion is required for the secretomotor. Submandibular ganglion is carrying secretomotor fibers to that of submandibular gland and that of sublingual gland. Pterygopalatine ganglion, which is also called as ganglion of hay fever, it is also called as sphenopalatine ganglion, and it is giving innervation to lacrimal gland, nasal, palatal glands and all. So these are not the option. The correct option which is giving innervation to parotid gland is otic ganglion. It's through the glossopharyngeal nerve and it is supplying parotid gland. So just see here in this diagram, the important things can be visualized, that the preganglionic fibers is arising from inferior salivatory nucleus, which is located in the lower part of pons, which is lying very close to that of pontomedullary junction. You can see here, this is pons, this is medulla, so it is lying very close to pontomedullary junction. Okay, and it gives the branch goes through glossopharyngeal nerve, has got tympanic branch from tympanic plexus, then through the lesser petrosal nerve. Ultimately the fibers, parasympathetic fibers, preganglionic fibers, which was arising from inferior salivatory nucleus, will relay in otic ganglion, and from here auriculotemporal nerve arises and gives secretomotor fibers to parotid gland, which is required for watery secretion from parotid gland. So I just want to show you the flow chart also. So the same thing which I have explained is represented in the form of flow chart. You can see here, inferior salivatory nucleus located in lower part of pons. From here preganglionic fibers arises, passes through 9th cranial nerve, that is glossopharyngeal nerve, and it's one of the branch, that is tympanic branch, is forming tympanic plexus over the medial wall of middle ear cavity. From here petrosal nerve arises, relay in otic ganglion, postganglionic fibers arises, pass through auriculotemporal nerve and supplies parotid gland. This is required for secretomotor. This carries secretomotor fibers to parotid gland. So in brief, we have done with the secretomotor pathway of supplying the parotid gland in short. Now moving to the next MCQ. So this is the 4th MCQ of today's session. Which is not a branch of vertebral artery system? So it is, the MCQ is telling about which is not a branch of vertebral artery system. So please mark, this is very important. It is not asking directly the branch of vertebral artery. It is asking vertebral artery system. Actually vertebral artery system means, this is marking that whether the branch is from vertebral artery or from basilar artery. So together vertebral artery and the basilar artery will form vertebroarterial system. So following branches are there: basilar, posterior cerebral, anterior spinal and ophthalmic. So for solving this MCQ, I will show you the diagram and I will also write the branches of vertebral artery and basilar artery. Okay, and also internal carotid artery. So see here. So firstly, seeing this diagram, let me just highlight this diagram. Okay. So here internal carotid artery is shown in the diagram, which is forming, as you can see, internal carotid artery is there. Okay, its important branches can be seen: middle cerebral artery, anterior cerebral artery, ophthalmic artery, and you can also see there is a communication between two side anterior cerebral artery. So these are important branches of the internal carotid artery. Here also you can see the choroidal, anterior choroidal artery. Okay, so in the option, moving to the option again, ophthalmic artery. So ophthalmic artery is not a branch, as you have seen. Ophthalmic artery is a branch from, let me just again show you this in large view here. So can you see here, ophthalmic artery is a branch of internal carotid artery. Ophthalmic artery is a branch of internal carotid artery. So this is the correct answer to the MCQ. Again moving to the MCQ. Yes, this is the correct answer to the MCQ, that it is a branch from ICA, internal carotid artery, and not a branch from either vertebral or basilar artery. Okay, so we have marked the correct answer, but I just want to brief you about the branches of, important branches of vertebral artery and basilar artery. So just moving to that session. Now, firstly, I want to show you the branches from this diagram. See here, this is the basilar artery shown in the diagram. So see here, there are two vertebral artery on either side. The two vertebral artery together joins and ascends up to form basilar artery, which is lying in the basilar sulcus of the pons, and it gives branches, that is superior cerebral artery, posterior cerebral artery. The branches from vertebral artery which is shown is anterior spinal artery, posterior inferior cerebellar artery. Also the branches, these are the branches of vertebral artery. The branches of basilar artery which is shown is pontine branches, anterior inferior cerebral, superior cerebral, and that of posterior cerebral artery. So these are the major branches. So quickly just write down the branches. Branches of internal carotid artery. So branches of internal carotid artery is following: ophthalmic artery, okay. Also it gives anterior choroidal artery, anterior choroidal artery. It gives anterior cerebral artery and middle cerebral artery. It also gives the communicating branches, okay. So these are the important branches, these are the important branches of internal carotid artery, which is given in the cranium, in the brain area. So I am just talking about this. Further, there are so many branches of these important arteries, okay. So we have seen also here, okay. It also gives contribution for the communicating artery, posterior communicating artery. Yeah. So for the blood supply of brain and its detail, there is another session in which I have detailed it. So for here I am just going into just the enumeration, not going into the details that which surface of the brain or which area is supplied by these arteries. So we have done with internal carotid artery. Now coming to the branches of vertebral artery, okay. Vertebral artery branches. The vertebral artery branches are following: anterior spinal artery, so I am writing in short, posterior spinal artery, anterior and posterior spinal artery, both anterior and posterior spinal artery, two branches. Third is pica artery. What is pica artery? That is posterior inferior cerebellar artery, posterior inferior cerebellar artery. And also it gives medullary branches, and also it gives fifth branch is the meningeal branches. So all these five arteries name which I have written is the branch from the vertebral artery directly. So when we talk about vertebral system, we talk about both the branches from vertebral artery and also from basilar artery. So write down the branches of basilar artery. The branches of basilar artery is following: anterior inferior cerebellar artery, labyrinthine artery for internal ear, pontine branches which we have seen in the figure, pontine branches, superior cerebellar artery, and posterior cerebellar artery, posterior cerebral artery, posterior cerebral artery. So all these are branches of vertebral system. Okay, so we have already marked the correct answer as in the diagram, that ophthalmic artery is the branch from internal carotid artery and it is not a branch of vertebral arterial system. Now coming to the fifth MCQ of today's session. So let me just enlarge it. Which of the following is not true? So the options are: angular artery is distributed to superior part of cheek, lower eyelid. Occipital artery is distributed to the scalp of back of the head. Superficial temporal artery is distributed along parotid gland and duct. And the fourth is mental artery is giving distribution to the facial muscle around the skin and the chin. So 4 options are there. And for solving this MCQ, I want you to know the details of all the arteries which is mentioned in the option. So starting with the first, that is angular artery. So let's start with the discussion of the first artery, that is angular artery. Okay. Now, so we are seeing in the diagram the angular artery has been shown. So let me just enlarge this diagram. Okay. So this is the angular artery. Okay. See here, angular artery is lying very close to the nasal bone. Okay, nasal aspect here, going medially towards the nasal aspect. So this is actually a branch of facial artery. Angular artery, if you will see, it is arising from the facial artery. So this is the facial artery, and angular artery is, let me just enlarge this diagram. As you can see in this image, angular artery, and it is arising from facial artery, and it is going towards the nose aspect. This all area, nose aspect, middle aspect of the nose is supplying. Angular artery is giving arterial supply. So let's write down the important points about angular artery. The first option, angular artery is actually terminal branch of, it's a terminal branch of facial artery. It's a terminal branch of facial artery, and it is located along the side of the nose. It is located along the side of nose and goes up to the orbit or eye, and goes up to inner part of eye cavity and orbit. Okay, it's giving blood supply. Where it is supplying? It is giving blood supply to nose area and to the upper and lower eyelid. Mainly it is giving blood supply to nose area, upper and lower eyelid, and the area along with it, the cheek area, which will lie cheeks area along this lower and upper eyelid close to the nose. Okay, so let's move to the first option. So see here the first option. Yeah, which of the following is not true? So the first option is angular artery is distribution to the superior part of cheek and that going towards the lower eyelid. So this is correct. Yes, it goes towards the medial aspect of the nose and then goes up towards the orbit and the eye towards the medial aspect, and also supplies the lower eyelid. So this is correct option. Now moving to the second option. So second option is about occipital artery. Let me just check. Yes, occipital artery is distributed on the back of head. So let's see the occipital artery. Now as you know, occipital artery is one of the branch from external carotid artery. So let's just see the diagram. This is the occipital artery, and it is a branch from external carotid artery, and it is given posteriorly at the same level where the facial artery is given anteriorly. So this branch which you are seeing is occipital artery, and this is given posteriorly and at the same level where facial artery is given anteriorly. Okay, it's a branch from external carotid artery. It's a posterior branch of external carotid artery. So let's write down the important points about occipital artery. Occipital artery arises from external carotid artery, okay, opposite the level of facial artery, opposite the level of facial artery, okay. And which area it supplies? Actually, it gives blood supply to the back of scalp. It gives blood supply back to the back of scalp. Also, it gives some blood supply to sternocleidomastoid muscle. And also to deep muscles of back, and also to the neck. So yes, the second option is also correct, which we have seen. We have just seen the second option, and in the second option it is given that occipital artery is supplying the back of scalp. Okay, so it is also correct. Now moving to the third option, let me again read the third option. Superficial temporal artery. Superficial temporal artery is distributed to parotid gland and duct. So let's see superficial temporal artery. So see here, this is the outline of parotid gland. So what you are visualizing here, this dotted line, let me just connect it. This outline is of parotid gland. So inside the substance of parotid gland, we are seeing the maxillary artery is traversing. Okay. Now external carotid artery has got two terminal branch. One is the maxillary artery, another is superficial temporal artery. Also, we are seeing another branch which is lying close to the parotid duct. This is parotid duct PD I am writing, and the transverse facial artery is lying close to it. Okay. So actually superficial temporal artery is the branch which is not giving blood supply to parotid gland or parotid duct and all. It's the transverse facial artery which is giving the blood supply. So option C is absolutely wrong. So write down the details. So I would like to describe both the transverse facial artery which is giving blood supply to parotid duct and also about superficial temporal artery. Now transverse facial artery. Okay, transverse facial artery is actually a branch from superficial temporal artery. It's a branch from superficial temporal artery which run across the face, and it runs across the face. It is running across the face. Okay, so actually what happens, it runs across the face and it is going along with the parotid gland and in relation to parotid duct. So it traverses along parotid gland and it also lies close to parotid duct. Okay. So yes, if we talk about the blood supply of parotid gland and parotid duct, so that will be transverse facial artery, which itself is a branch of superficial temporal artery. But superficial temporal artery is not directly giving blood supply to parotid gland or parotid duct. Okay. Now, so it is supplying. So you can write transverse facial artery is supplying. In short, you can write parotid gland duct, and also masseter muscle, and also the skin around these areas. It also gives blood supply to the skin around these areas. Okay, done. Now if we talk about superficial, so we have talked about transverse facial artery. The next artery which was given in the option was superficial temporal artery, and superficial temporal artery supplies. So it is not supplying the parotid duct and parotid gland as we have seen. So what does it supply? What does the superficial temporal artery supplies? It supplies facial muscles, skin of the frontal area, temporal region. So it is supplying facial muscle, skin around frontal and temporal region. So yes, option C is absolutely wrong, as we can see. So we have got the correct answer, but let's see the fourth option given here. Okay. So superficial temporal artery is distributed to parotid gland and duct. So this is not right. So this will be the correct answer to this. Which of the following line is not correct, or option is not correct? It's not the superficial temporal artery. It is the transverse facial artery, branch of superficial temporal artery traversing inside the parotid gland and duct and giving distribution to parotid gland and duct. Now coming to the fourth option, that is mental artery. Is it supplying the facial muscle and the skin of chin? So moving to the fourth option, let me show you the mental artery diagram. So see here, in this diagram you can see the mental artery. Let me just highlight that artery. Okay, so this is the mental artery, as you can see. Okay, and you can see the mental artery is giving branch close to that of the chin. Okay, you can visualize the mental artery is giving branch close to the chin. Actually, it is the terminal branch of inferior alveolar artery, and inferior alveolar artery is a branch of maxillary artery. So write down the information. Mental artery is actually terminal branch of inferior alveolar artery, and inferior alveolar artery is a branch of maxillary artery, and maxillary artery is a branch of external carotid artery. External carotid artery. Okay, and this mental artery is supplying, the mental artery is giving blood supply to which area? It is supplying, it is giving blood to, or it is giving arterial supply to skin and muscles of chin. Okay, so this is correct, this is option correct. So only option C is incorrect. We have already found the correct answer to the MCQ. Now before ending this session, I would like to tell you that if you want to join Unacademy platform, you can just download the app of Unacademy, search for NEET PG platform. This is the Telegram group link of Unacademy NEET PG platform, and you can also, if you want to have an anatomy discussion, you want your doubts of anatomy to be cleared, and any doubt related to MCQ or any doubt related to exam and all, you can just connect to my Telegram group link, which is provided here in the discussion session. Also Telegram group link is provided. Also, if you wish to join the Unacademy platform, you can use my code Dr. Lisa -YT to get 10% discount on Unacademy subscription. Now, my free sessions, live free sessions are on Thursday, Friday and Saturday, and generally my YouTube session is released on Friday and Sundays. Okay, so keep studying, all the best, and if you want to join, you can join the Unacademy platform by using my referral code Dr. Lisa -YT, and below my anatomy group link, Telegram group link is also provided, so you can join this group for the discussion of anatomy topics. Thank you, all the best, keep studying. We will again meet with the new session of anatomy MCQ discussion. That will be the part 14. So till part 13 anatomy MCQs videos are there. So those who have missed the previous session can revise their previous videos also. Thank you.